So why is it that some people can have a huge amount of degeneration within a joint but not have very much pain, and some other people can have a lot of pain but not very much degeneration within their joint? Well, as it turns out, there isn't that much of a link between arthritis and pain. So just because you've got arthritis doesn't necessarily mean you're going to have much pain. So therefore, this begs the question of what causes the pain when someone has arthritis. Is arthritis actually anything to do with it? Well, find out in this video and stick to the end to find out how chiropractic can help you with arthritis. Let's begin.
Hello and welcome to yet another video. My name is Dr. Stephen Hulme. I'm a chiropractor based in Reading, and in this video I'm going to be talking about arthritis, specifically degenerative or osteoarthritis. So the good place to start is what it is. Arthritis is essentially a wearing down of the joint surface in your body. This can happen anywhere within your body. Most commonly it affects the joints that get the most wear and tear or get the most trauma, and these are going to be your hands, your knees, your hips and your spine. Now what happens is that inside your joint you have two bones that articulate with each other, and in between you have a fluid that helps to cushion the joint, and then covering the ends of each one of the bones you have a type of tissue that helps protect those bones. This allows for then smooth and proper motion within the joint. What happens in arthritis is that you get a wearing down of this joint surface, which after some time can start to cause some inflammation in the area and a decrease in the space within the joint, which then leads to pain. What it isn't is the systemic type of arthritis, the rheumatoid arthritis, where you get an autoimmune response where your body's immune system starts attacking the joints within your body, and this causes a fairly similar process where you get a wearing down of the joints, but it's a very different cause. The cause here is more of an inflammatory response that's causing it, rather than a wearing down, rather than a traumatic event, rather than trauma affecting that joint. And so today we're going to be talking about osteoarthritis. It's not necessarily linked to pain. The amount of times that people tell me, oh, I think it's just old age, or is it age that causes arthritis? It's not really age that causes arthritis, because if it was, you would get a similar amount of wear and tear or degeneration in all of your joints, but that's not what we see. What we see is a degeneration in particular joints, and quite commonly they're the joints that you've used the most throughout your life, or ones that you've had trauma in the past, and this is usually what it's caused by. So it can be caused by slips or falls in the past onto your back, for example. It can be caused by sports injuries or previous surgeries. Anything that's traumatic to a joint will affect the function of the joint. And this is the interesting thing about arthritis, is that there isn't a huge link between the amount of arthritis somebody has within their joint and the amount of pain that they experience. In fact, there's been several studies looking at this where they've taken a whole bunch of people, random, whether they've got pain or not pain, and they've looked to see how much degeneration they have within their joints, and then they correlate with that with how much pain that they have. And what they find is that some people will have a lot of pain with little degeneration, and some people a lot of degeneration and little pain. So this tells us that there's something else, something more going on. And if you talk to anyone like a chiropractor or any other manual therapist that helps people get out of pain from arthritis, they'll tell you that usually we get fairly good results with getting people out of pain, but if you were to re-x-ray them or re-image them, you wouldn't see much of a difference in the amount of wear and tear within their joint, which tells us again that there's something more going on. And I think this comes down to function. It's how well your joint is functioning will determine how much pain you're going to be in. And what we're doing as chiropractors or other manual therapists, but specifically chiropractors, is that we're improving the function of that joint. We're improving the way that that joint moves to get more symmetrical movement, so that the wear and tear, so that the pressure within the joint is actually being spread out evenly. An analogy I like to give is that if your car tires are not properly aligned, then you're going to get more wear and tear on specific areas of that tire more than the rest. If it's very well aligned, you're going to get more of an even distribution, and joints are fairly similar. If they are functioning well, if they're moving symmetrically, and if they're moving in the proper way that they're designed to move, then the wear and tear should be evenly spread. Now, another part of this, another cause of arthritis that we've seen in studies is immobility. They did a study where they immobilized the necks of rats for a number of weeks and compared them to the necks of rats that did not have their necks immobilized. And they saw that those that had it immobilized had a lot more degeneration within that joint, and there was no movement within that area. So this is another cause of arthritis, and this is one of the issues in the way that we treat our spines with this sedentary lifestyle we quite often have. Is a lifestyle that causes little movement within the spine, and we need movement, which I've stressed many times in previous videos for this exact reason. Because when we don't have movement, we get less function into that area. So in summary, it's not necessarily the arthritis that's the cause of your pain, it's the loss of function, the way that that joint is operating, that will cause the pain that you get, which is why professionals such as chiropractors can get fairly good results with improving the pain in those people that have the wear and tear within that joint. So if you have been diagnosed with arthritis, then don't lose hope, because although we can't get rid of that, there is good chance in most people that we can improve or sometimes get rid of the pain that you're in by improving the function of that joint. So I hope you've enjoyed this video. If you have, you might enjoy this video here, which is about the effects and the importance of walking, and then why we need to walk every day to get the proper motion and to avoid this dysfunction and pain within our spines, but also within other joints within our bodies. So I hope you're having a great day, and hopefully I'll see you on my next video. Bye bye.